What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing wonderful. Thanks, everybody, for listening once again. Hopefully that we can give you some good information to keep you healthy and well.
Yes.
So today we're going to talk about vitamin K. And I'm not talking about the K, the chemical symbol for potassium. A lot of people get that confused. Like the chemical symbol for potassium is K, but which is a mineral. We're talking about vitamin K, and the K stands for coagulation. It's the German word coagulation. And the reason why it's coagulation is because that is one of the first things we found out that this vitamin does. It helps with blood to coagulate and to clot.
Right.
So
super important.
Super important.
I cut my finger on Monday. Thank God I had vitamin K.
Right. It helps. Definitely. It helps with clotting, the clotting pathways. It is a fat soluble vitamin, and it's best known for its role in blood clotting. But there are a lot of other roles for vitamin K that people don't realize. And it's a vitamin that I think is going to be kind of the new superstar on the block soon. That's the more research we go. You know how vitamin D is like the go-to vitamin, so to speak. It's like the vitamin of the day. Everybody knows about vitamin D. Yeah. You know, I would say it's the main one. Well, what's really interesting is vitamin D actually works much, much better with the other fat-soluble vitamins, vitamin K, vitamin A, and vitamin E, but especially with vitamin K. And we'll go into some detail here, but vitamin K essentially tells calcium where to go in the body. It directs it to the appropriate places. You can think of it that way. We'll go into some of the detail in just a minute. Whereas vitamin D, we think about vitamin D being used for bone health. It also has numerous things that it does in the body, beneficial things in the body, but mainly we think about it as helping with bone health. And so a lot of people who've been diagnosed with bone diseases like osteoporosis or its precursor osteopenia, most doctors will recommend vitamin D, but unfortunately, they don't recommend it with vitamin K, and they should, based on what we know what vitamin K does for bones. So that's a really big thing that vitamin K does. Vitamin D, you can think about real simply, you can think about vitamin D taking calcium from the gut, from the food that you eat or from the supplements that you take, and helping it into the blood. And then you can think about, this is a real basic understanding, but then you can think about vitamin K taking that calcium and directing it to the bones. Now, there are a lot of other things that happen along the way. And vitamin A and vitamin E, actually, those other fat-soluble vitamins actually help direct calcium away from where it should not be, like soft tissue, into the bone. So I bring that up because that's very important, because one of the biggest issues with calcium supplements is we don't know where it really goes. And a lot of times it can contribute to depositing, like hardening of the arteries and depositing in soft tissue where it should not be, which can cause all kinds of problems, which we'll get to.
Yeah.
So let's just back up a little bit and talk about what vitamin K is and how to get it in your diet. So basically vitamin K, the natural forms, there's vitamin K1 and there's vitamin K2. And vitamin K1 is found mostly in like green leafy vegetables, and it plays a big role in photosynthesis in plants. The main issue of vitamin K1 is that it's really bound to like chlorophyll really, really tightly. So it's hard to get good absorption of that. However, in animals, especially with healthy gut bacteria, vitamin K1 can get converted into vitamin K2. And vitamin K2 is the main, I would say main storage form or the most bioavailable form of vitamin K in the body. And vitamin K2 is broken up into, has different subtypes
Mm-hmm.
to it. And
Mm-hmm.
these things usually range from like MK4 to MK11. So let me back up just to make things clear. So vitamin K1, the the main name for that one is phylloquinone. I think I'm saying that right. Um, and then the chemical name for vitamin K2 is menaquinone. So hence the initial for the subtypes for the vitamin K2, MK4, MK7, MK11. So it's menaquinone. So you don't get confused on that.
Mm-hmm. And these subtypes are found in our naturally occurring diet, like you mentioned, those dark green leafies, or
Well,
no?
they can be found in the diet, but they're certainly not found in the diet as much as vitamin K1.
Okay.
Vitamin K1 kind of gets converted in the intestinal tract by gut bacteria. Okay. So the microbiome will convert K1 into these menaquinones or into vitamin K2.
Okay.
All right. So so the main ways to get vitamin K1 are through like green leafy vegetables, but there are foods that have vitamin K2 in there. And the food with the most vitamin K2 in there is called natto. And I
Hmm.
think we talked about this before, Brian. Natto is a fermented soybean delicacy in Japan. I tried it once. It's the worst tasting thing I ever had in my life. It was right up there with fermented shark that I had in Iceland. I mean, and it smells awful. However, it's very healthy for you. But if you ever have a chance and go to a Japanese restaurant that serves natto, you should at least get it. You probably won't want to smell it after you see it and smell it. You probably want it off the table, but you should at least, I think, at least see what your palate thinks of it. But anyway, it's very high. It's very high in vitamin K2. Okay, more
Okay.
so than the other foods that we eat. So vitamin K2 is found in some animal products like cheese and egg yolks, chicken liver, pate. Um, but it's always better to supplement with K2 unless you have lots of natto around, which I can't see how anybody can eat that unless you have a palate for it, which I don't even see how you can have a palate for it. But it is a very it's a health promoting food and it has tons of vitamin K2 in there.
Yeah. So to get those optimal levels, you are recommending some supplementation.
Right, right.
Mm-hmm.
And there, just so people know, there are synthetic forms of vitamin K, K3 through K5. We talked about the two forms that are naturally occurring. That's vitamin K1, vitamin K2. Vitamin K2 has the subsets, the menaquinones, MK4 through MK, 11, and so on. But the other ones are synthetic, and some of these synthetic forms of vitamins are used, you know. Um, Kind of like I think they use some of them in animal feed and things like that. I think vitamin K3. You would never find any of these in supplements though. Some of these uh, K3 through K5 have some toxicity to them or may have toxicity. And there's no known toxicity of taking K1 or K2. Okay,
Okay.
as long as you are healthy and not on any blood clotting drugs. All right, and the main blood clotting drugs, and I should say specifically the blood clotting drugs that you don't want to be supplementing with vitamin K with are Coumadin and warfarin because they are vitamin K antagonists. That's how they work. We talked about vitamin K helping with coagulation, right? Well, if you're trying to thin the blood by being taken away vitamin K, so it can't help with coagulation, then you certainly don't want to give vitamin K to somebody who needs thin blood. And that's the whole thought of it. The nice thing about this, though, is a lot of people now conventionally are getting away. Docs are not prescribing as much Coumadin or warfarin as they used to because
Mm-hmm.
it's a big problem. It can make you vitamin K deficient for one. Hence, that can have an impact on your bones and cardiovascular disease. Which we'll talk about in just a minute. But also, a lot of foods like greens have vitamin K in there. So you're basically giving somebody a drug and then telling them, well, we really don't want you to have these green leafies. And that's what they used to do. They used to put these people on a white foods diet. Now, if you
Wow.
are on those, yeah, it's crazy. And now if you are on those drugs, then basically what they do is they just try to dose it based on a consistent diet of greens. So if you told your doctor, well, I eat a salad every day, they're going to adjust your dosing of the warfarin or Coumadin based on that. And they're going to tell you, well, all right, if you know you eat one bowl of salad every day, certainly don't eat 3 or 4. It can have devastating consequences if you do that in one day. So they try to make it consistent, which is a better way to go, right? So just eat consistently, and then we'll adjust the dosing to that. Those drugs are really awful, and they are basically forms of rat poison. I mean, that's what they use in rat poison, is these blood thinning drugs. So these rats would eat this and then bleed out. So
wow.
Yeah,
and so if you're taking vitamin K, Keoni, and you're not on any drugs, there's no, like you were saying, there's no risk of clotting too much or kind of increasing that clotting. Okay.
No, not at all. Not at all. I want to just talk about I want to go into like what conventionally vitamin K is used for in the US. Okay, the main things that it's used for from a conventional standpoint. I use it a lot for my patients for various things, but conventionally in the US it's used for primarily 2 things. One of them we just talked about, right, with kind of not taken if you are on warfarin or Coumadin. However, guess what? If you poisoned yourself with rat poison, that's a vitamin K antagonist. Guess what they're going to do conventionally? They're going to give you a lot of vitamin K, right? So that's kind of one use conventionally they would use. But the main use for it is on newborns. Most newborns when they're born are pretty much vitamin K deficient. They just haven't developed enough to produce their own vitamin K. They don't have a diet that's feeding them, so they can be vitamin K deficient. So a lot of times when a newborn is born, the first thing they do is they give them a vitamin K injection. So vitamin K deficiency can occur during the first few weeks of infancy due to the low placental transfer of phylloquinone, right? From the mother. So they get low clotting levels, and therefore, and also nursing, I've heard mothers say, well, I'll just nurse my baby and maybe they'll get it through breast milk. To some extent, that's right, but they're getting very, very low levels of that. And so basically what can happen is these newborns can have something called, vitamin K deficiency bleeding. And it can be devastating and it can be fatal. So that's the main consequence for vitamin K. There are other things that can basically, where vitamin K is definitely necessary from a conventional standpoint. If you have like any type of malabsorption syndrome, cystic fibrosis may require that also. And we'll go through those in just a minute. But those are the two main uses for it. So we talked about vitamin K being kind of vitamin D's partner, right? And it is one of the things that helps with the mineral calcium. So people need these vitamin K around to make sure they have appropriate bone health.
Right.
And one of the things that can destroy bones from a conventional standpoint is taking a lot of corticosteroids, and corticosteroids have devastating effects on that. We talked about that on a number of podcasts, how corticosteroids over time can just ravage bones. Vitamin K, according to some of the research, can help mitigate that. So there's a use where I'll use it quite a bit. I haven't seen a lot of doctors thinking vitamin K to help offset the negative side effects of corticosteroids, but it definitely will help.
Yeah, it's a great one for me.
Yeah, and then the other one is anybody who has an eating disorder like anorexia or bulimia nervosa, those disorders wreak havoc on the bone too. You can give them some protection by giving them vitamin K, or at least having a supplement with vitamin K in it. Anybody who's suffering from a compromised liver function will benefit from vitamin K. And then we also talked about decrease in fracture risk with osteopenia, osteoporosis. Vitamin K is there. I've actually read some studies that said vitamin K may even be more important than vitamin D for decrease in fracture risk. I don't think there's enough study on that, but definitely should be taken both for bone health. And it's part of our bone building protocol at our clinic. Like, I don't ever give a vitamin D supplement without vitamin K. And I want to give a vitamin D supplement. I will give a mix either with K1 and K2 in that supplement.
Okay. So is it pretty often that they're paired together within the supplement industry, Keoni, or no?
Not often enough. I can't tell you
Yeah.
how many patients come in just on vitamin D, and I'm like, you should think about switching to one that has vitamin K in it also.
And as far as your daily K recommendation, do you have an IUs or a level that we should be intaking?
Gosh, let me think about this. I don't know the numbers off the top of my head. I can tell you this: the numbers in the vitamin D, vitamin K supplements far exceed the daily recommendations, and I think that's a good thing. I mean, you're not going to get in trouble with taking too much of it.
Okay.
And I just don't think you can get enough in your diet. I don't know the exact numbers that would be in those supplements from what I remember.
Yeah. Have you developed kind of a ratio that you like? And maybe not.
No.
Okay.
In the supplements, I put my trust into those supplements that I use as far as getting the right ratios in there. A lot of the supplements that I use, especially the pharmaceutical grade ones, have, basically have the ratios down to what they are. But the amounts of vitamin D relative to vitamin K are going to be much, much higher. You're going to have much, much higher. You don't need as much vitamin K as you certainly do as vitamin D.
Okay. And
now,
when you flip over the supplement label, you should see K1 and K2 there.
You should. I think yes. You should see both there. At the very least, you should see K2. Okay. But usually the ones I give have both of those forms in there.
Okay.
It is interesting though in Japan, where they've done a lot of the research on vitamin K. They are, for certain things like cancer and stuff, they're using very, very high doses of vitamin K. So certain cancers seem to be kind of fought. Vitamin K2, especially vitamin K2, has a protective effect seems to have a protective effect against liver cancer, and some other cancers too, like lung, bladder, colorectal, stomach, bile duct, prostate, non-Hodgkin's lymphoma, certain brain cancers. So there's an anti-cancer effect of vitamin K2 based on some of the research that's come out of there. Much more research is needed. But the nice thing about it is, like we said, you're not going to get in trouble taking too much of this stuff. And they're doing pretty large doses in their studies in Japan on this.
Wow. And do you have any understanding of what, like what the mechanism or why that has any sort of, why it works at all?
I don't. I think what we don't know is that vitamin K has a lot of effects on the body in particular. I mean, some of the mechanisms that they're seeing, and I can't get into detail on it, is it seems to help fight cancer at each stage of the cancer. Like, you get the initiation, you get the the growth and progression of the cancer, and each stage of that, it seems to help prevent spread, seems to help prevent the onset of cancer, and then also seems to help fight against the cancer. Now, it's not one of these things that I've read where it's going to be like, I'm certainly not going to call it a cancer cure or anything like that, but it does seem to help. And that's great, especially when you can take something that is not going to hurt you. you know,
Right.
and it, yeah, so, and it's not that expensive either. So, but it is interesting to think about this, Brian, is like one thing we do know about cancer, like if we know something for certain, we know that eating a plant-based diet protects against cancer. We know that, you know, there's not any dispute against that, really. You know, like there may be with like the vaccine we talked about yesterday, or the
Hmm.
you know, there's a little bit more controversy with that than saying, you know, you eat a high plant-based diet, you're reducing your risk of cancer, you
Right.
know.
Yeah.
And it may have something to do, since vitamin K1 at least is very high in plant-based foods, especially green leafies. It may just, you know, be that may be the one of the mechanisms by which it help, you know, these plant-based foods help fight cancer. um Interesting thing there with Alzheimer's disease, people that have this genotype of ApoE4, which is highly correlated with Alzheimer's disease. There's some research that indicates that vitamin K may, and especially in this group of people, may prevent the nerve damage that goes along with Alzheimer's disease, which is really cool. So vitamin K supplementation may help stave off diseases of dementia, and especially in these ApoE4 carriers who are at high risk for this. So that's really cool. Now
Yeah.
we talked about vitamin K1 being converted into vitamin K2. This happens typically in the gut. But think about what happens if you're on antibiotics all the time and you're just killing all the gut bacteria. You know, well, there goes a possible deficiency of vitamin K if you're constantly on, if you don't have good gut health or good microbiome, or they're constantly being destroyed by antibiotics. So
Yeah.
that's something to look out for that. And I've had numerous patients over the years who've been on, you know, tons of antibiotics for one reason or another. And so these people are probably a group of people that need to be supplemented, not only with probiotics, but also with vitamin K to help them.
Yeah. I mean, it's useful to know for everyone. If you get sick and you get a round of antibiotics,
Yeah,
you can kind of
yeah.
reboost that up that way.
And then you can also think about people with bowel disease, like, you know, anybody has their gut compromised, celiac disease, irritable bowel syndrome, ulcerative colitis, you know, et cetera, et cetera. I mean, there's tons of bowel disorder diseases and malabsorptive disorders where vitamin K um, is going to be needed. Um, you know, so the other thing to think about here, there's a drug out years back. I don't know if it's being used now a lot. A lot of these weight loss, there were some weight loss drugs out there. And I think we talked about them in a couple podcasts. One was called Orlistat. Basically, what it does is it completely inhibits uh, fat from your diet to be absorbed. Hence, if you don't absorb fat, which is very calorically dense, then it will help you lose weight, right? So
Hmm.
basically, you know, these fat soluble vitamins over time, if you're taking drugs like that, you become deficient in them, right? So you can
Hmm.
become deficient in vitamin D, K, A, and E. So that's another thing where you may want to consider supplementing with fat soluble vitamins. Um, as far as cardiovascular disease, I want to hit on this because I think this is where vitamin K can be really important. Um, there's something out there called a calcium score that is really indicative of cardiovascular problems. I mean, if you have high deposition of calcium in your soft tissue, especially your arteries, vascular, you know, any vascularity anywhere, you are talking about significant issues, and it's highly correlated with, you know, heart attack, stroke, a number of things. And if those arteries lose their elasticity by hardening, by calcium deposition, then you have significantly increased blood pressure, right? You're more at risk for aortic tears, aortic aneurysms. I mean, you name it. You, for any cardiovascular issue, it's a big deal. And what we are finding is, or what the research seems to indicate, is the higher intake of vitamin K, especially vitamin K2, the lower your risk of coronary heart disease. And it may be due to, you know, vitamin K, just telling calcium where to go.
Right.
You know, and you know, there are a bunch of proteins in your body that are vitamin K dependent. They have names like matrix GLA protein or MGP. It's a vitamin K dependent protein that plays a role in the prevention of vascular calcification. And although, you know, and again, there's much more study that needs to be done on this, but when that protein is under carboxylated, that's the way vitamin K works. It helps carboxylate these proteins to make them active. Basically, it takes carbon dioxide and puts a carboxyl group on this protein, and then it is able to do its thing. But if they're under carboxylated, basically meaning you don't have a lot of vitamin K doing what it needs to do, then you're increasing your risk of vascular calcification and a significant risk of coronary heart disease. The one thing I really want to find, I can't find the studies on this, but it seems like it would indicate it. You know, a lot of people over the years have come into my clinic and had very high calcium scores, which is not good, as we were just saying. And from a conventional standpoint, there's not a whole lot you can do with that, right? I mean, basically, docs are going to wait until, okay, well, you have a high calcium score. They really just send them home, go, well, we just need to really be careful and watch, you know? So basically, we're waiting for a catastrophic event before we can do something. And, you know, then we go in there and change the plumbing, so to speak. We wait till something's broke. Well, here's something that's very simple that may have a very powerful effect for putting the elasticity back into the arteries by just giving vitamin K, you know, at a high level of vitamin K. Again, it's not going to hurt. We don't have like great studies to show this, but we do have some studies that indicate it does work. For example, in an observational study in the Netherlands, what did they do? 564 postmenopausal women showed that dietary intake that of menaquinone, that's vitamin K2, not phylloquinone, that's vitamin K1. But anyway, the intake of vitamin K2 was inversely associated with coronary calcification. So we have that study. Of course, it's an observational study, and we'd like to see more. But that's, you know, that's pretty cool, especially when you can give something that's not going to hurt them. You know, and let's see. Do I have another study here? In another study, they took 4,807 men and women aged 55 and older from the Netherlands. They looked at menaquinone intakes, and basically they saw that a lower risk of coronary heart disease, the higher the vitamin K2 intake. It was interesting that vitamin K1 did not have a significant effect on that, but vitamin K2 certainly did. And that there's a whole lot of there may be a whole lot of factors with that, where vitamin K may not be getting, vitamin K1 may not be getting converted, or they just didn't measure it appropriately based on people's diets and things like that. But those are interesting studies.
Yeah, absolutely.
Let's see.
Certainly observationally backs up all the reasonings for what you're mentioning using it for.
Right. There's another study, one randomized double-blind placebo-controlled clinical trial. I think they did in this one phylloquinone, so vitamin K1, in 388 healthy men and postmenopausal women aged 60 to 80. Participants received either a multivitamin containing B vitamins, vitamin C, vitamin E, plus 500 IU vitamin D3, 600 milligrams calcium, 500 micrograms of phylloquinone. This kind of hits back to your question. I mean, based on the relative vitamin D to phylloquinone and other things. I mean, you're talking about microgram dosing of vitamin K as opposed to milligram dosing. So it's small dosing, but considered high for vitamin K.
Yeah.
Basically, what they found was There was no significant difference in coronary artery calcification between the treatment and control groups. However, among the 295 participants who adhered to the supplementation protocol, that this study went on for 3 years, they found that the treatment group had significantly less coronary artery calcification progression than those in the control group. So there you go. I mean, I think that
longevity vitamin.
Yeah, I mean, there's something special about vitamin K, hence special K. Then osteoporosis. Let me get to some of the trials in Japan. Most of these trials with vitamin K and osteoporosis were done in Japan, the ones that I saw. And here's a trial on postmenopausal women, range from 6 to 36 months. This was a meta-analysis. So you took a bunch of studies. All right, we took a bunch of studies, and so the studies were ranged in trial duration from 6 to 36 months. 13 trials were included in this review. 12 of those showed that supplementation with vitamin K4 improved bone mineral density. 7 of the 13 had fracture data that showed that vitamin K2, especially the MK4 form of its subgroup, significantly reduced rates of hip fractures, vertebral fractures, and all non-vertebral fractures. So that's really cool. I mean, I think that's really cool from also, your point of view with the medicine you practice. It's like, somebody's coming in with a bone fracture. I mean, it's just very simple to just look at what they're doing to help their bones and go, hey, if you're just taking vitamin D, you may want to get on vitamin K2, K1, K2 also with it. It can help.
Yeah, absolutely. Especially I see a lot of corticosteroids like we mentioned.
Yeah, and especially and how the trial duration was from 6 to 36 months. I mean, that's not a long time to see improvement.
And that's a window of healing your fracture.
Right.
6 to 12 months. Yeah.
In one of these studies, we had 381 postmenopausal women receive either 1 milligram of vitamin K1, and then here's where we get really high doses in the Japanese studies, or 45 milligrams of vitamin K2, the MK4 form, or placebo for 12 months. All participants also received daily supplementation of calcium and vitamin D3. At the end of the study, participants receiving either K1 or the K2 had significantly lower levels of undercarboxylated osteocalcium, right? So remember we talked about vitamin K makes sure that these proteins like osteocalcium get carboxylated so that they can do their job.
Right.
Yeah.
At one point you mentioned a K4, I think, Keoni. How many Ks are there?
Well, just
I know we talked about the subtypes within the.
Right. So to clear it up, because it's a bit confusing, the natural forms of vitamin K are K1 and K2, and K2 has different subgroups. All right.
Okay.
And those are called the menaquinones, and they're subset from the main subsets used. They're actually numbered from 1 to 11, maybe even more now, but the main forms used are 4 to 11. These are the natural subsets of vitamin K2. But there's also, so those are subsets of vitamin K2, but there's also synthetic forms of vitamin K that we talked about, K3 through K5.
Okay.
And those aren't really, we shouldn't even talk about it, because I probably confused a lot of our listeners even talking about them, because they're not really useful to our discussion. I just brought them up. But really just think about vitamin K1, vitamin K2. Vitamin K2 has a lot of subgroups called the MK subgroups, right? 1 through 11. You can think about the main forms used in the body that have the most study are MK4 through MK7.
Okay.
All right. So, what else? So we talked about interactions with medications. We want to be careful with warfarin, Coumadin, or similar anticoagulants that are vitamin K antagonists. Right now in the U.S., docs are not prescribing those as much, but however, there are still some people on them. Antibiotics destroying gut health can decrease vitamin K status. Bile acid sequestrants such as cholestyramine, cholesterol are used to reduce cholesterol levels by preventing the reabsorption of bile acids. Well, at the same time, this can also reduce the absorption of vitamin K and other fat soluble vitamins. And then we talked about, Orlistat, or the fat loss drugs that inhibit absorption of fat. That can also cause problems there. What else? I mean, if people are interested, as always, they can just contact us. They can either go to contact me and go my clinic, and we can get them on a good supplement that has K1 and K2, or contact you. I mean, I don't know if you have a dispensary set up or not yet, but at least you can point them in the right direction. But,
yeah, absolutely. And most of this was from your newsletter, Keoni. So how do people sign up for that?
They can actually go to nhcnc.com, and in there they'll see a link to sign up for an email newsletter, and that's the one way they can sign up for it. Or awesome. they can just simply get in touch with us here, and we can give them the link for that.
Perfect.
Yeah. So anyway, that's it. I mean, I think I covered everything that I want to cover on this. I think vitamin K is one of those things where we're really going to see some neat stuff coming out about it in the future, as more and more study, as we get more and more study and understand what it does in the body.
Yeah, absolutely. Super important for all healthcare professionals to know. It's like you mentioned, There are 2 or 3 things that are highly valuable to me there that I did not know.
Yeah. Yeah. And it's a non-toxic vitamin. I mean, you're not going to hurt somebody with this as long as, you understand the drug interactions that we talked about.
Right. Awesome. All right, Keoni. Well, thank you everyone for listening. Thank you everybody for tuning in this week, and we will speak with you next week.
Take care, everybody. Thanks for listening.